This is Tre Kwon with Left Voice in New York City at Mount Sinai Hospital at an action organized by the COVID-19 Frontline Workers Task Force. Healthcare workers, nurses, and doctors are gathered here this morning to denounce the critical shortage of PPE causing their exposure and even the death of colleagues in our ICUs in New York. It's another episode in the continued class war where the idea that we're all in this together is completely bogus. We saw how a $2 trillion stimulus package to bail out corporations leaves workers in the dust. While the companies are protected, nurses are dying, doctors are dying. So the benefits going to workers were pitiful. We saw that Trump and Cuomo, they're talking the big talk, but these demagogues, they're leaving the ventilator shortage and PPE untouched. They're even blaming nurses, accusing them of hoarding supplies. And Cuomo today, he's scrambling to build hospitals in Javits Center, in Central Park, but he is one of the he's been one of the pioneers of hospital mergers, community hospital closures of the last decade. He's also never backed nurses' demands for safe staffing ratios. He's in fact been one of the most pioneers of austerity measures in New York State. So we see that the only solution today is in our hands in worker solidarity and class struggle. We need to nationalize healthcare today. We need the private sector hospitals in public hands and profit completely out of the equation. We also need to nationalize manufacturing and industry in order to get to work immediately to build ventilators and assist with this emergency response. But what happens when you put, manufacturing and healthcare under public or Trump's hands? He's just another billionaire boss, another billionaire bigot. This control needs to be under workers' hands, democratic worker control. So we're here today in the spirit of the Amazon workers who walked out on Monday to denounce the retaliation against Chris Smalls. We're here in the spirit of Purdue meat workers who are on strike and the GE workers who are calling that they should go back to work immediately and build ventilators. We hope that this is among the first of these sorts of actions across the city and the country where frontline workers, essential workers, not just nurses, but all those of us, even the unemployed, come out and mobilize, speak out, and fight for more, fight for a better, fight for a different system. Thank you.